Imagine that you're 8 weeks pregnant. You're excited, everything seems to be going well, and then you start to feel cramping. Suddenly, your mind starts racing. You might find yourself wondering, does this mean something is wrong? Cramping in early pregnancy can feel really unsettling, especially because it can feel a lot like period cramps. And for many women, that immediately brings up the fear of miscarriage. But here's the key thing to understand. The details matter. How strong the pain is, where it's located, whether it comes and goes or keeps getting worse, and whether other symptoms are happening alongside it. All of that matters. So in this video, we're going to walk through the different patterns of cramping in early pregnancy, what might be causing them, and how to recognize when it's time to get checked out. And on this channel, we talk about pregnancy, women's health, babies, and being a mama. So if this sounds like your kind of space, make sure to hit subscribe. And also, let me know in the comments, are you pregnant? And if you are, how far along are you? Okay, first, can we just acknowledge something? Cramps suck. Period cramps suck. Pregnancy cramps suck. Like, why does something completely normal have to be painful? All right, so we've established that cramps suck. Now, just so we're on the same page, when I say cramps, this is what I mean. Lower pelvic cramping, a feeling of pressure or a dull ache. They can last for a few minutes or longer. They might come and go. Sometimes they can even stick around for days. Cramps can show up when your bladder is really full. They can happen when you're constipated. Sometimes they just happen when you're tired. But here's what most people assume. Cramping means a period. A period means you're not pregnant, so cramping must mean something is wrong. That shortcut makes sense, but it's not actually accurate. So let's talk about why cramping happens in early pregnancy. A lot is changing inside your uterus. The uterine lining thickens to support the pregnancy. Blood flow increases significantly to deliver oxygen and nutrients to the embryo. Hormones also start affecting the uterine muscles, making the tissue more responsive as it adapts. As the uterus begins to expand and blood flow increases, the uterine muscle can tighten slightly. These mild contractions, combined with stretching and increased circulation, can create that crampy feeling many women notice early on. So, in other words, the very changes that support a healthy, normal pregnancy can also be the reason you're feeling cramps. But there are other things that can cause cramping too. For example, sex. And this is something a lot of women ask about. Can sex cause a miscarriage? The answer is no. In a normal, low-risk pregnancy, intercourse does not cause pregnancy loss. There's no scientific evidence that sex or orgasms trigger a miscarriage. Your baby is very well protected by the uterus, the amniotic fluid, and the mucus plug. Now, that said, orgasms can cause the uterus to contract. So yes, sex can lead to some cramping, but it does not cause miscarriages. These cramps usually start shortly after intercourse, tend to be mild, and typically go away within a couple of hours. Now, let me zoom out for a second, because not all cramping in early pregnancy is coming from the uterus. For example, some cramps can come from your intestines. Pregnancy hormones slow down digestion, which can lead to gas, bloating, and pressure, and that gassy discomfort can feel very similar to uterine cramping. Another possibility is something that's not normal but is very common, a urinary tract infection, or UTI. A UTI can cause pressure and cramping in the lower pelvis, and remember, your bladder sits right next to your uterus. UTIs usually come with other symptoms too, like burning when you pee, feeling like you have to go urgently, cloudy urine, sometimes reddish or brownish urine, and occasionally fever or back pain. If you think you might have a UTI, that's something that needs to be checked out because treatment requires antibiotics from your provider. Now, there are two situations I want you to clearly recognize: miscarriage and ectopic pregnancy. And I'm not bringing these up to scare you, I'm bringing them up because the cramping patterns look different from what we've talked about so far. Understanding those differences helps you know when something needs to be evaluated versus when it's something you can simply monitor. So let's walk through those patterns. When cramping is related to a miscarriage, the pattern changes. The cramps don't stay mild and come and go. They start to increase. They become stronger over time. Instead of fading, they build. And often, another symptom shows up as well: bleeding. So now we have to talk about how cramping behaves when bleeding is also present. Cramping by itself can be common, but cramping that's getting stronger and happening with bleeding, that's different. When a miscarriage is happening, the cramping usually becomes stronger. The bleeding may start off light, but then it gets heavier. The blood is often bright red, and the flow can increase. You may pass larger clots and sometimes even tissue. But the key feature here isn't just the bleeding, it's that both the bleeding and the cramping are progressing. They're getting worse. Now, let's talk about ectopic pregnancy. With an ectopic pregnancy, the cramping pattern often looks different. The pain is usually focused on one side of the abdomen. It might start off mild, but then it becomes more intense. Bleeding, in this case, may actually be light, which is why the amount of blood isn't always the most important clue. Other symptoms can show up too, like dizziness, feeling faint, shoulder pain, or just feeling generally unwell. Now, the reason we're talking about all of this is to help you recognize patterns. It's about noticing when symptoms are escalating or behaving differently from typical early pregnancy cramps. So, mild, stable, off-and-on discomfort behaves one way, but pain that keeps getting worse, feels intense, or comes with symptoms like dizziness or feeling unwell, that behaves differently. And when that pattern shifts, that's your signal to reach out to your medical provider. Also, keep in mind, medical problems don't always read the textbook. They don't always show up exactly the way we expect them to. So if you ever have symptoms that you're unsure about, call your provider or go in and get checked. It's always okay to ask. Sometimes even providers don't have an immediate answer. They may need to monitor things over time, like repeating your HCG levels or doing follow-up ultrasounds to get a clearer picture of what's going on. But I do hope this video gives you a better understanding of which symptoms shouldn't be ignored. I'm not trying to help you diagnose yourself, that's not your job. I just want you to understand these patterns well enough to know when it's okay to rest and observe, and when it's time to call your provider and get checked. So if there's another topic you want to learn more about, you can click right there, and I'll see you in the next one. Thank you for watching.